Joining me now is Dr. Nick Gilpin, who is the Director of Infection Prevention and Epidemiology at Beaumont Health Medical in Michigan. Doc, thank you so much for joining me. And, Dr. Fauci and other healthcare experts are saying that Detroit is the next hotspot for coronavirus in this country. Does your hospital have everything you all need for this expected rise in cases?
Well, I think so. So you said it. I think Detroit is definitely a hot zone. We're seeing an unprecedented level of disease activity right here in our backyard. The message I've been getting out is that coronavirus is here. It's in our community. It's here to stay, at least for the time. I think as far as our own preparations have gone, I feel pretty good right now in terms of our bed capacity situation and ventilator capacity and PPE, but it also feels like in a lot of ways we're living paycheck to paycheck on those things.
You work for the biggest hospital system in Michigan. You mentioned the uptick in activity in cases. What else are you seeing in your hospital at this point?
Well, one of the things that I worry about constantly is our staff. I worry about our physicians and I worry about our nurses, not just because our nurses and doctors themselves are starting to get sick, but also because they're working incredibly hard and incredibly long hours. I've been noticing that a lot of my staff is really doing great work. They're banding together in ways that are unprecedented, and I'm proud of all the work they're doing. But I worry about their well-being.
We all are, and we're so grateful to each and every one of them. And when you think about, you look at what's been happening here in New York. I was talking to a reporter a second ago in Central Park. They're setting up a field hospital in Central Park in the middle of Manhattan. You there in Michigan, you're at the beginning of the spike with the peak expected still weeks from now. What have you learned from New York?
So one of the things that I'm watching very closely in New York right now is obviously their PPE usage, their ventilator usage, and their bed usage, and I'm very much interested in how they're balancing their staffing. One of the things that we're working on here is the concept of what we call load balancing. The idea being that a lot of hospitals in Southeast Michigan are getting hit very hard right now, but there may be hospitals in the surrounding areas that are not being hit as hard. And so what we're trying to do is fairly balance the load of patients and equipment across all the different hospitals. So, for instance, the hospitals like the ones that I represent that are being hit very hard might be able to move patients or take equipment from some of the hospitals and healthcare systems that are not being hit as hard. And that's something that we're really pushing very hard on, and it's something I really hope our governor will support as well.
What is, Dr. Gilpin, at the top of the list in terms of just the most pressing issue you and other doctors are dealing with right now?
So I have to go back to staff. Last week I think the answer would have been PPE. I think that we've had a lot of great stories in terms of a lot of businesses, private businesses have really stepped up and have provided us with some PPE. I've seen innovations, companies that manufacture products like roofing have converted their factories to producing isolation gowns. So that really gives me a lot of hope. And I feel better about our PPE situation today, but the staffing is the big one. So, you talked about setting up field hospitals, and that's great. But I guess the thing that concerns me is who's going to work at these field hospitals? Who are we going to staff those beds with? We're going to need nurses and we're going to need physicians. And that's the big concern.
Right. What do you do, not if, but when, because they are on the front lines when they get sick? Dr. Nick Gilpin, thank you so much for being with me and for talking all things Michigan. Be well. Thank you, Doc.
Thank you.
Coming up, Louisiana.